Hello students, today we'll start with the new topic, that is space maintainers in pediatric dentistry. So the term space maintainer was first coined by J.C. Brower in the year 1941. He defined it as the process of maintaining the space which was previously occupied by a tooth or a group of teeth. This is my teeth. Okay, so this is my tooth. Now there is a premature exfoliation of this, so here the space will be created. So it is a process of maintaining the space which was previously occupied by a tooth or a group of teeth. Another definition by Boucher, it was given as the appliance or device which maintains the space in dental arch which was previously lost due to early exfoliation of primary teeth. Again, Boucher has defined it as the appliance or device which maintains the space in dental arches which was previously lost due to early exfoliation of primary teeth. Appliance or device maintains space in dental arch which was previously lost due to early exfoliation of primary teeth. Okay. Now there were classifications of space maintainer, that was according to Hitchcock, according to Raymond C. Thoreau, according to Henderson. So the classification of Hitchcock was given in the year 1973. He had classified it as removable, fixed, without bands, with bands, functional, non-functional, active, passive, or certain combination of above. Easy. First is removable, non-removable. Second is without bands, with bands, functional, non-functional, active, passive, and combination of above. This was Hitchcock in 1973. Now comes Raymond C. Thoreau. He has classified in 1978, 73, 78. He had as, this is how I remember, Raymond has given removable, complete arch, and individual tooth. Complete arch includes the lingual arch or the extraoral anchorage. Removable, complete arch, individual tooth. Now Henderson, 1962, means first Henderson has given the classification. 1973, 1978, 1962. He had classified it as fixed or removable. In fixed, class 1, class 2. Class 1 is the non-functional, that is non-functional means where the suppose like the band and loop, means there is a loop, it doesn't help in the function. It doesn't have a tooth, it does not replace the missing tooth. So non-functional includes the bar type and the loop type. Functional involves the pontic type. Functional means the tooth will be present. Pontic type, lingual arch types like the Groper's appliance in the anterior, and the pin and tube space maintainer. Pin and tube space maintainer is given when the loss of primary central incisor, and it allows the lateral growth of the maxilla. Class 2 is the cantilever type, that is distal shoe. Means cantilever types means behind there is like this, it's a cantilever type. This type is known as cantilever type. Okay. Now types of space maintainer: fixed, removable. In fixed, band and loop, crown and loop, band and bar, crown and bar, Mayans, lingual arch, palatal arch, transpalatal, transpalatal, and fixed appliance for anterior. We will read it in details. Before starting that, we should know what are the indications. Space maintainers after space after the primary teeth loss, that is premature exfoliation, and which is showing the sign of space closure. If the use of space maintainer makes future orthodontic treatment simpler. When the succedaneous tooth is not close to erupt, when at least 1 mm of the bone covering is present. Now according to McDonald's, it is said that the time taken by a tooth to travel 1 mm of bone is 4 to 6 months. So now you will post it in the comment, if 3 mm of bone is there, then how much months will it take to erupt. Okay, so 1 mm 4 to 6 months. Space analysis: potential risk for space inadequacy for secondary teeth due to unbalanced force from adjacent teeth. That is space analysis you should do, and if you find that there is a potential risk of space inadequacy for the permanent teeth because of the unbalanced force from the adjacent teeth. Now what are the contraindication? If there is no bone coverage, if the root of the permanent teeth is near to the tooth herd completion, no succedaneous tooth bud, when space is created which is less than the mesodistal diameter of the crown of the permanent successor. Now what are my requirements for space maintainers? It should maintain the mesodistal diameters, it should be simple in design, it should withstand the occlusal force, should not interfere or deviate the path of eruption, it should easily adjustable, it should not interfere with speech, it should be cost effective and no food entrapment, and it should promote effective cleaning. Okay. Now how should we do our case selection? Suppose in cases of early loss of second deciduous molar, in congenitally missing second premolar, the permanent molar should be encouraged to drift mesially to close the space created. In congenitally missing permanent lateral incisor, the cuspid should encourage the drift to mesially so to close the space or created. In cases of missing or extracted first permanent molar, the second permanent molar should be encouraged to be drift mesially to close the space created. Delayed eruption of permanent anteriors may lead to the development of tongue thrusting habit. So you must see all these cases and decide whether you should give space maintainer or it is not indicated. Okay. Now what are the factors which affect the planning for space maintainer? It is the time elapsed since the tooth loss. Space closure takes place within the 6 months after extraction, and hence appliance should be inserted just after the extraction. And it is said that the maximum space loss just after the extraction occurs between 76 hours. Rate of space closure. The space closure is rapid during the first 6 months after the extraction and more rapid in younger children. The amount of bone coverage over the tooth, as I have already discussed, according to McDonald's, 1 mm of bone requires 4 to 6 months, and hence if there is bone coverage over the erupting successor, the space maintainer should be planned. Dental age of the patient calculated as per the age of the last permanent teeth erupted in the oral cavity. Root formation status. The tooth erupts in oral cavity when 3/4 of the root formation is completed. So you should know the no last stage. Abnormal oral habit. If there is a tendency of the development of abnormal oral habits after premature loss of primary teeth, space maintainer should be planned to prevent exertion of pressure on dental arches. Now what are the commonly used space maintainer in pediatric dentistry? Removable non-functional space maintainers, that is, it is made up of an acrylic plate placed over the alveolar mucosa within the space created without any artificial teeth. Okay, why? Because it is a non-functional, you won't be having any teeth. Removable non-functional space maintainer, acrylic plate placed over the mucosa without any artificial teeth. Now removable functional space maintainer, okay, it is made up of acrylic plate, same with artificial teeth or composite teeth to replace the lost primary teeth. It is usually bilateral and is used to restore aesthetics and mastication. I hope it is clear. Now next is the band and loop space maintainer. Most common fixed space maintainer, which is indicated in single loss of primary molar or bilateral loss of single primary molar before, this is important, before the eruption of permanent incisors and the loss of second primary molar after eruption of first permanent molar. Modifications includes crown and loop space maintainer. This is a crown and loop space maintainer. Okay, crown and loop space maintainer. Band and bar space maintainer, long band and loop space maintainer, Meehan's band and loop maintainer. Meehan's band and loop maintainer, that is what happen in cases where there is an enlarged tongue macroglossia. The width of the band and loop is decreased. Reverse band and loop in cases of premature loss of E and premature loss of E, we can band the D. Bonded band and loop space maintainer, crown and crown over the crown you can give band and loop space maintainer. Next is the Nance palatal arch space maintainer, bilateral, non-functional. Non-functional means there won't be any teeth. Passive maxillary fixed space maintainer, indicated to stabilize maxillary first permanent molar in position when there is bilateral premature loss of primary teeth. Bilateral premature loss of primary teeth. Nance palatal, bilateral, non-functional, passive maxillary fixed space maintainer, indicated to stabilize maxillary first permanent molar in position when there is a bilateral premature loss of primary teeth. Now comes the transpalatal arch. Okay, Nance palatal in bilateral, transpalatal in unilateral, non-functional, passive maxillary fixed space maintainer, stabilize maxillary first permanent molar in position when primary molars require extraction. Now distal shoe space maintainer, you must be knowing it very thorough. It is known as intraalveolar appliance, indicated when the primary second molar is lost before the eruption of first permanent molar. Okay. Now the last is the lingual arch space maintainer, that is the bilateral, non-functional, active or passive. I will let you know how it becomes active. When it becomes active, you can use a space regainer, and that is the Holt's lingual arch, in which you add the Wilson loops are added. Primary molars after the eruption of mandibular permanent lateral incisors. So once again, removable non-functional space maintainer, removable functional space maintainer, band and loop along with its modification, transpalatal arch for bilateral loss, transpalatal arch for unilateral loss, distal shoe when the permanent 6 haven't erupted, and early loss of deciduous E. Then lingual arch space maintainer, it is bilateral, it is non-functional, can be active or can be passive. Mandibular fixed appliance, indicated in unilateral or bilateral loss of primary molar after the eruption of mandibular permanent lateral incisors. Okay, if it is not erupted, mandibular permanent lateral incisors are not erupted, you can give band and loop space maintainer. Okay, so you have to be very thorough what type of question is being asked and what is the requirement. Okay, now coming on to the modern design of space maintainer. Ribbon space maintainer, glass fiber reinforced space maintainer, simple wire direct bonded space maintainer, EZ space maintainer, Nichols appliance and H appliance. These are the modern design. So what is a ribbon space maintainer? Basically it is just a combination of composite plus polyethylene fibers. Again, composite plus polyethylene fibers. It is biocompatible, it has got high strength, fiber reinforced, as you know, polyethylene fibers is there. Ribbon fibers was first introduced in 1992. It has ultra high strength. Polyethylene fibers, it has got high breaking point, which is compared to fiberglass. It absorbs less moisture. Key success is due to lino weave. You have to remember this. Key success is due to lino weave, and also it can adapt the contour of the teeth. No lab work is needed. It has got good integration of fibers with the composite resin. Again, ribbon space maintainer, composite plus polyethylene fibers, biocompatible, fiber reinforced, very high strength, absorbs less moisture. Key success is due to lino weave. Adapts well to the contour of the teeth, no lab work, good retention of fibers with composite resin. Okay, the study was done by Kalar et al. I have remembered it as, I call it as color ribbon color 2012. This will be made up of composite. Okay, ribbon space maintainer. That's it. This is my tooth, this is the space loss, this is the tooth. Kalar et al. 2012, he said that ribbon as aesthetic space maintainer. It was published in the International Journal of Dental Sciences. Once again, Kalar et al. 2012, International Journal of Medical and Dental Science. International Journal of Medical and Dental Science. Good. Now next is the glass fiber reinforced space maintainer. It is easy to apply, single visit. It is not important, no lab work is needed. It is aesthetic, less bulky, ample clearance between the underlying tissue. The study in 2008 was published in the Journal of Indian Society of Pediatric Dentistry, Pediatric and Preventive Dentistry by Subramaniam P. et al. And he concluded that glass fiber reinforced composite resin retention was shown as 53% and good patient acceptance. Again, glass fiber reinforced space maintainer, easy to apply, single visit. It is no impression is needed, no lab work is done. Aesthetics, less bulky, ample clearance between the underlying tissue. Study by Subramaniam P. et al. in a Journal of Indian Society of Pediatric and Preventive Dentistry 2008. Okay, limitations: it is technique sensitive, debonding of enamel and composite interference. It's like this. Now next is the simple wire direct bonded space maintainer. When abutment is caries free or minimal restored, must be placed, we can use this simple wire direct bonded space maintainer, but it must be placed under rubber dam. Now next is the EZ space maintainer. It is a prefabricated space maintainer, quick and easy, made up of stainless steel wire. It is present in various sizes and configuration to accommodate different space requirements and tooth position. prefabricated है, so it is easy for placement, good adaptability, durability, oral hygiene considerations is good. This is how it is. This is my tooth, this is my space, like this it is E and Z space maintainer, EZ space maintainer. Okay. Now Nikhil's appliance. It is an innovative tube and loop. It is not very easy to fabricate, but it is quick and can be done in single visit. The steps are the stainless steel band. These are my molars. Stainless steel bands are adapted over that molar tube is given, and then a V-shaped stainless steel wire is formed with a helix in between, and it is given in the angle of 30 to 45 degree, and then the wire is inserted into the tubes, and then the prepared loop is placed into the buccal tubes, and final adjustment is done by coiling and uncoiling. The study was published, of course it is Nikhil's appliance, so published by Dr. Nikhil Srivastav et al. In the year 2016. Again same like this journal, which was same journal of that of Subramaniam P et al. That is Indian Journal of Clinical Pediatric and Preventive Dentistry 2016, and it has concluded in the study that this design and appliance has got successful outcome. Now the next is the H appliance, which is a bracket. It is a bracket and a hook appliance. It is not very easy, but less instruments and no lab work is needed, no welding or soldering. Okay, so these are my modern designs. Again we'll read the modern designs. Ribbon space maintainer, composite and polyethylene fibers, glass fiber reinforced space maintainer, well accepted, and glass fiber space maintainer. The study was done Ribbon ka Kalar et al. 2012, glass fiber Subramaniam P et al. Indian Journal of Clinical Pediatric and Preventive Dentistry. Simple wire direct bonded, must be done under rubber dam. EZ space maintainer, prefabricated, quick and easy, different configuration, good adaptability, durability, oral hygiene considerations. Nikhil's appliance in the year 2016. Nikhil Srivastav, published in Indian Journal of Journal of Indian Society of Pediatric and Preventive Dentistry. In Journal of Indian Society of Pediatric and Preventive Dentistry 2016. And last is the Edge appliance. It has got a hook and bracket appliance. No soldering and welding is required. Okay. Now critical evaluation of the this question sometimes come, critically evaluate the space maintainers. Okay. So these are the various studies which was done, and it was published in the article Harun Achmad et al. In the year 2021 in European Journal of Molecular and Clinical Medicine 2021. European Journal of Molecular and Clinical Medicine 2021. Okay. First in 2014 by Nikhil Srivastav and Inder Kumar et al. Has done a study on banded versus bonded space maintainer, finding a better way out, and they told that the bonded space maintainer are still, band and loop space maintainer are still considered as gold standard, and minimum retention is of super splint. Then again by Nikhil Srivastav and Nikhil Marwa et al. 2014 on simple fixed functional space maintainer. Functional means artificial teeth will be there, and it has good and the conclusion was acceptable design for space maintainer. Simple fixed functional space maintainer. Then A. Vinotini et al. In the year 2019, functional band and loop space maintainer, and it was good acceptable. Then Bhagyashree et al. In 2019, he innovation of 3D design of band and loop space maintainer, and it was quick and precise. They conclude that it was quick and precise. Then the next was by S. Deshpande et al. In the year 2018, survival of bonded space maintainer, and he told that the bonded space maintainer when it adapts good to the teeth has better survival. Then S. Sami et al. In the year 2018, the effect of fiber reinforced composite resin on the levels of lactobacillus and S. mutans in the saliva, and it concluded that fiber reinforced composite resin for short duration of time can help in preventing preventing caries as well as the level of lactobacillus and this S. mutans. Then MS Sarvana Kumar in 2013 has done a study on fiber technology in space maintainer, and he concluded that glass fiber composite space maintainer for short term has good success rate. Then as we have studied about this Nikhil's appliance, Nikhil Srivastav in 2016, tube and loop space maintainer, it is an acceptable design and clinicians should use in general practice. Then Sudhir Mittal et al. Has done a study on banded versus single sided bonded in 2018, and he told that the patient acceptability for fiber reinforced composite resin was higher as compared to conventional. Then AJ Ahmad et al. In 2018, glass fiber reinforced versus band and loop and crown and loop, and he concluded that crown and loop space maintainer has the best longevity. Crown and loop for when there is an early loss of first primary molar, and glass fiber reinforced under rubber dam for premature loss of primary second molar. Then Shilpa et al. In 2017, he used a Q-sil denture, and he told that it is acceptable design to maintain arch integrity and functional balance. Then S. Sasa et al. 2015, clinical success for longevity of band and loop and crown and loop space maintainer. He told that band and loop has lesser longevity. Failure was more due to decementation, and in crown and loop was due to the breakage in the soldering area. Then Harleen Kaur et al. In the year 2017, he said that adaptation of CAD-CAM for fabrication of metal-free band and loop, and he concluded that ceramic band and loop has more sustainable alternative as compared to conventional band and loop. So ultimately, all of these studies have concluded that space maintainers are important for primary stage or mixed dentition. It helps in maintaining the space, and for this awareness should be increased. So I hope this was clear. We have covered the critical evaluation, all the various studies which have been done, the modern design, the conventional design, the indications, contraindications, how to do a case selection, factors affecting the planning, definition, classification. So if you have any doubt, please post it in the comment section. I'll be happy to reply you. Thank you. I hope it was informative.